So what does HIV actually do to the body? So on a system-wide basis, it's going to weaken the immune system and sort of affect the memory of the body's immune system. So they have a decreased ability to destroy any type of infectious agent that comes their way. So, you know, upper respiratory infections, the flu can be deadly for someone with HIV. So it's more the long term that's affected. So your lymphocytes, your T lymphocytes and your B lymphocytes, the T cells, the CD4 plus cells, and then B cells neutralize the microbes. So you lose the ability to do that when you have HIV. So what happens with the progression from HIV to AIDS? So at the onset of infection, people will have like a flu-like illness, and they just might dismiss it as the flu. And that's when they're getting a really big production of the HIV virus once they've been infected. And then once they move into stage 2, the asymptomatic stage, and that's the World Health Stage 1, people can, stay there for years. They don't have any symptoms. They're a carrier of the virus. They can definitely transmit it to other people, but they have no idea that they have it. So that is why, from a public health perspective, it can be very scary. Stage 3, when people start to get those opportunistic infections, and that's when they're known to have AIDS, and they develop the certain types of cancers like the Kaposi sarcoma. And then the full-blown AIDS, the stage 3, weight loss, muscle atrophy. If any of you, saw the Oscar-winning movie Dallas Buyers Club, I think you can get a good idea of how thin people are, with the weight loss and some of the side effects of drugs. People with HIV, especially if they're asymptomatic, are perfectly okay to exercise. In fact, every commercial gym probably has somebody with HIV as a member. So as long as they don't have symptoms, they can be treated as normal adults. They might have a little bit of fatigue due to low physical activity. But if people are showing signs of, illness, they're feeling very fatigued, they've got a fever, don't test people and don't have them work out those days. If they're not feeling that great, they might have to do a reduced workout. If they've got some symptoms, they may have a higher heart rate during exercise, but they're clearly not going to be able to do as much work. And then people who have full-blown AIDS are going to have a drastically reduced exercise performance. They may not even reach the intensity of their ventilatory threshold. They're going to have abnormal responses from their catecholamines, so they're not going to be able to reach their target heart rate. But exercise can be effective. Unfortunately, there really aren't a whole lot of studies in this area. It's a tough population to study. Obviously, with a lot of these special populations, getting a large sample size to study and make across the board nationwide recommendations is going to be really challenging. But it does appear to be safe for people who are at least stable in their disease. It doesn't seem to make their HIV status worse. So, it may not make them a whole lot better, but it definitely doesn't seem to make them worse. But you have to wonder if they are someone who is at risk of other infections. Can they be in a large-scale gym? Do they maybe need to have a home-based workout or at a specified, research center or clinical center with other patients if they're prone to other infections? But overall, they can improve their fitness, and even a small amount is going to make a difference with their quality of life. And obviously, if weight loss and cachexia is a problem, they can, do some resistance training, but it hasn't really been well studied at all. Medications. So the HIV specific that actually try to stop the virus. Again, NRTIs, you can see, they're going to inhibit the RNA so the virus can't replicate. Protease inhibitors. So once again, going to stop the genetic proliferation. And then inhibitors that prevent HIV from attaching to cells. and from, attaching to other cells as well. And other drugs they may be taking because of other conditions, cholesterol drugs, if they've got the high cholesterol, they may also have diabetes, and they may also have to have some nutritional interventions with protein supplements. And the role of exercise with the medication is not really been studied. So we really don't know what type of interaction these are going to do as far as performance, heart rate, ECG changes, or anything like that.